Hello, I'm Dr. Leibovitz, your Central Indiana go-to foot doc. We're going to talk more about warts. Now, we've had two videos before. One was talking about the two ways of differentiating between warts and calluses. The second video was about the myths and home remedies involved with warts. Now we're going to talk about why your treatment's not getting rid of your warts. We're really talking not about reoccurrences, but the wart's just not going away. So the most common failure there is that it's not a wart. That's why it's nice to know if it's a wart or not. Let's go check that first video out. Warts will respond very well to certain type of treatments, chemical cautery, while other skin lesions will not. So know the difference. Now, chemical cautery is in the medicine or an agent we're going to use. It's going to create such a focal area of irritation that the virus is not going to want to hang around and will eventually leave. When we treat this, we want to make sure that we only treat the wart, not the surrounding tissues. That will cause some local irritation, and that normal skin is going to let you know about it, cause discomfort, and people are then going to discontinue treatment. So when we start actively treating the wart, what's going to happen, the wart's going to respond and create a very thick, kind of soggy layer of tissue. That will do two things. One, it's going to cause pressure to walk on, and it's going to cause discomfort, and you're going to want to stop treatment. Two, it's going to create this thick armor where the medicine can't get to the virus. It's a self-protective mechanism. So we want to keep this area very, very thin. Another big problem is consistency or inconsistency. You can't start and stop this medicine. It's consistent. You're going to use it at least twice a day, and if it's only 2 or 3 weeks, you think that's how long it's going to be, it's a mistake. It may go 2 or 3 months or longer. Over-the-counter medicine, cautery medications, are typically an 18% salicylic acid, maybe 17. That's a pretty weak strength. We want to use a much higher strength to get a greater effect from that. I want you to be cautious though with this medicine. Read the label. If you're diabetic, if you have poor blood supply, or you can't feel and have neuropathy, you don't want to use this medication. Another issue is that when people stop their treatment when they run out of medication. Well, the wart may not be done, you want to make sure that you have a supply of the medication. Other treatments we use for warts are excision. And that's a very easy, straightforward method and very effective. But if you miss a lesion, if there's an adjacent lesion close by, or the other foot or the other hand, your chances are really high for that to regrow in that area. It's kind of like dandelions. If I cleaned out only half my yard of dandelions, in a short period of time, my yard's going to be filled with dandelions again. You got to treat all of it. You can't just do partial. Other treatment options would be freezing or cryotherapy, electrocautery, lasing using a laser, or ultrasound, which is a newer therapy. But those all have difficulty with depth control. So if you're too shallow, it's like cutting the top off of a dandelion, and you know it's going to grow back. If you go too deep, you're going to damage the basement membrane, and that's going to cause a scar, which may be worse off than the original problem. Another issue is you can't get any pathology from these areas. They destroy the skin tissue. You can't send them out to prove that it was a wart. Another big factor would be an impaired immune system. If it's fatigue, other health problems, sometimes some medications can knock out the immune system. You're not going to respond very well to medications and treatment options for warts. Another thing that can happen is that the warts can get resistant to that treatment. They're just not moving ahead. Well, if it goes for a period of time, depending on which treatment it is, you want to change gears and go to a different treatment. Einstein's definition of insanity was doing the same thing over and over again, expecting different results. Well, that's a lot of information on warts, probably more than you ever wanted to know, and I kind of apologize for that. If you want to know about foot problems, go to my website at gotofootdoc.com. I'm Dr. Leibovitz, your Central Indiana go-to foot doc.